Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, it is my great pleasure to welcome Yelena Korpacheva. Yelena is a nursing professional development specialist at Stanford Healthcare, I should say, in California. She's a certified oncology RN and a Caritas coach. She also serves as faculty for Watson Caring Service Institute. And Yelena says that she's passionate about employee well-being, professional development, and quality of nursing care. So thank you, and Yelena, for joining me. Welcome.
Thank you so much for having me. It's a beautiful platform for letting nurses voice their concerns and advocacy.
It is my great pleasure, Yelena. Really, it is. But tell me, why did you become a nurse?
Well, there's definitely many answers to that, but one that comes to my mind when people ask me that question is the journey of my dad and the journey of my people. I came from Kazakhstan, from a small town in Kazakhstan called Sinay. And this is where Soviet Union has tested over 400 nuclear bombs over the ground. So we had a testing site about 20 miles away from our town, and people could even see the rising of their testing site. And that created a lot of health problems in our population, a lot of cancer. The radiation caused a lot of cancer. My grandma, my granddad, and my dad unfortunately passed away from that, and we didn't have the care that they deserved. Coming to US, I saw that opportunity of developing, of learning and developing those skills to help people, something that wasn't available for my family when I was growing up. So that definitely inspired my passion for nursing.
I can see why. I can see why. I imagine so. So you came to the US as an adult.
Yes,
Yes?
I came to US. I was about 18 years old, so I had my 19 years birthday here in US, and
Hmm.
since then I led my life here.
Awesome, awesome. So coming as an adult and from that kind of environment, you're 19 or you're 18
Mhm.
into 19, and was
Mhm.
nursing the first thing you went into?
I explored several options for my career, but definitely volunteering at the hospital. I took a volunteering position at the hospital, and it was um, eye-opening to witness the care that people had here in the United States, and I really wanted to be a part of it. I also saw the innovation um, that took place in the hospitals, particularly here in Bay Area, and that
Mm-hmm.
really sparked my interest and motivated me to be here. Also, their health equity that's advocated here for, right? So again, coming from a disadvantaged background, I knew people who had more, who
Mm-hmm.
get better care, versus seeing my dad passing away and not being able to get the basic care. Um, and seeing completely the opposite picture here of how many resources, how many social worker and case manager. There are so many things. We have a lot of work to do here in the United
Mm-hmm.
States, of course, but
Mm-hmm.
we are on our way there, right? And that's inspiring to see.
Okay, okay.
Yeah.
So what would you say are the biggest challenges for you?
The biggest challenge in the nursing profession, you mean?
Mm-hmm.
Um, I've been a nurse for about 10 years. I've been with
Okay.
Stanford for about 8 years. And the biggest challenges I definitely saw um, is the support that nurses truly need to do their work well, right? Through many dimensions. I was a clinical nurse, I was in management, now I'm in education. And that's why I moved into caring sciences, and Caritas program is that like we truly need to give our nurses the tools to care for themselves. And that's a skill.
Yeah.
That is truly an art and a science to be able to balance that. So they don't create those barriers, right? Like our body, what do we do when there is stress coming towards our way? We create those barriers so next time not to join that stress. But when we see humans suffering, that's not a choice, right? That's not an ethical choice to just turn away. And we do to protect ourselves, but that violates our soul. And
Yeah.
that makes it so much worse. So how can we give the resources and tools to our care providers, not just nurses, but to all of our care providers to be able to engage with that human suffering without burning out, right? Like without losing that compassion, without needing to go into those dark spaces where we have to create those barriers.
Mhm. Yeah, and that would
Yeah.
you say in a nutshell is basically what Caritas is about.
Yes. So
Yes.
caring sciences give us the tools, right? It
Mhm.
gives us the language, it gives us the tools to engage in the humanity, to be okay and be present and be right there in that moment. With the people who are suffering. And that doesn't have to be in a hospital. That could be in your family. That could be in your personal life as well. That could be in a grocery store, right?
Yeah.
How do you create that authentic presence? How can you have enough courage to step into something that's uncomfortable and be there, right? No matter how uncomfortable that is, but just be there and be present.
Yeah. That is something that takes practice.
Yeah.
And as you use the word, takes courage too. You're
Yes.
correct. You're correct. Yeah. So you are certified oncology, RN.
Hmm.
What
Yes.
drew you to oncology particularly?
Yes. So again, like coming back from my background, I saw a lot of
The
cancer, a lot of
cancer.
oncology around our area without the ability to access the care that people truly needed, right? Coming to US, I have identified specifically my current employer, right, Stanford Healthcare, as a pioneer in oncology care. And being able to touch those physicians, right? Be there with them who develop groundbreaking treatments was truly an honor, and it's a circle, it's a full circle moment for me.
Mm-hmm,
Um,
mm-hmm,
Also, I really I was craving those tools and skills how to care for oncology patients. What are the treatments out there to address cancer? And my probably a lifetime goal is like, how do we bring it there, right? Like, how do we bring it to people that are disadvantaged?
mm-hmm,
And
mm-hmm,
over time, it kind of stopped being, well, how do I bring that treatment like where I grew up, right? To how do we give that treatment to everyone here, right? We don't
mm-hmm.
have
Right
to
where you
go
are.
far here, even in Bay Area, right? Like,
Mm-hmm.
yes, we have the most expensive zip codes, and yet we have people who are not able to access the care that they truly need. So
Yes.
that kind of like moved into the health equity for me more than even like oncology care. But inspiration to go into oncology came from my childhood, seeing what I saw, and then being able to be part of people's journey, caring for them and understanding that, yes, this is not what I was able to do for my family when they were sick, but I'm here. I am right now with that patient and I'm able to give the skills to that person,
Mm-hmm.
filled my heart.
Yes. I'm sure it does. I'm sure it does. So as I read your bio and you talked about one of your passions being employee well-being.
Mhm.
You've been a nurse now, you said, for 10 years. Have you seen or do you think you see any improvement in institutions paying more attention to employee well-being?
I think it became a very hot topic, right, after the COVID pandemic, and when
Mhm.
nurses truly voiced their concern about it. I don't think that burnout was new for COVID,
Mhm.
but that's the time when people heard us, right? And that's the power of that advocacy, like a power of actually speaking up and
Yeah.
being courageous to voice your concerns, right? So I truly, truly do believe that we are moving towards it. I don't think we are there yet. However, I do see, like, you probably noticed yourself, a lot of nursing conferences really picking up the theme of
Yeah.
the well-being, civility at workplace,
Yeah.
and then like all of the self-care,
Hmm.
etc.
Hmm.
So what I see in my organization, right? Like I cannot speak for every organization out there because we can speak big words, but not necessarily do the things, right?
Well,
And
right.
we see it in every level of our society. And I don't think the hospitals are exclusion for that rule. However, I do see it in my organization. So what we really adapting caring sciences theory into our work here. So we actually have a unit that is responsible for integrating caring science theory into our practice. We do work like caring sciences. There's a multiple levels, like you can become a Caritas coach, which is like a
Hmm.
6 months program. But what we did in our institution, well, we cannot send every single person to do those 6 months right out there, even though we have over 100 people who are Caritas coaches, Caritas nurses. So we created a Caritas nurse program here in the organization. So nurses for 4 months work with us and they develop the tools for self-care. They develop the tools for wellness, for their personal and professional wellness. And this is what we did like here in our organization. We also have a course that's called Promoting Civility at Workplace,
Yeah.
which also integrates caring sciences into this work. So we not only, and that is a 4-hour course, and we're not only teaching people how to address the bullies, how to address the incivil behavior. But we're also talking about, well, how do we promote wellness and how do we promote civility and how do we promote the teamwork? And
Hmm.
actually, we are opening up that course for public starting December. It was only internal, and now we see the need for that outside. People are
Hmm.
always asking us about it. So we're gonna open it to public. So anybody in public who would like, it's in person. So you kind of have to be local, right? But if you want to travel for that, we welcome you as well.
Hmm.
Um, and it's a 4-hour course that we have here promoting wellness and well-being as well. Um, yeah.
That's awesome. So as you're talking, there are two words that you mentioned in that little thing. You talked about,
Mhm.
burnout being present before COVID, and burnout is a big buzzword
Mhm.
now. And you
All
talked
right.
about self-care. So what do you do to care for you?
Yes. I adapted that idea of nursing myself, right?
Hmm.
And I will be very transparent with you, like I am in that moment, like right now it fluctuates for us,
Yeah.
right? There are, like when I was a new graduate, I was feeling that a pain and hurt and burnout and being like invisible, right? All of those things were building up. And that's where I found caring sciences. And I used the tools it's very simple, right? It's the presence, it's being mindful, it's checking in with yourself and understanding where you're at. How much do you have to give to the world?
Hmm.
Um, and also that self-reflection is important. So that's what I started with, that I am that moment right now, right? Like a month ago, everything is great, everything is blooming, the world is great. And then now I'm feeling that need. I am a little more tired, the children, the work, everything is kind of
Hmm.
building up, right? All of those. It's important to be honest and vulnerable, right? I can sit here and tell you, you know what? I am practicing all of those things and that always works. But it's not true, right? Like we will always fluctuate no
Yeah.
matter how many tools we have to care for ourselves. So in a moment right now, like I noticed that all of those, so that's step one, so self-reflection, right? Like, okay, if you have enough time to sit down and just check in with yourself, where are you at? And that will move you into what do you need, right? And for some days, that would be a going for my run, right? And then just release that energy that building up, whether it's negative energy, stress, whatever that is.
Whatever.
The other days, like today, that would be just sitting in front of, we have a beautiful, beautiful pond. It's like right there in my view right now. It's just sitting in front of the pond, right? And looking at the trees and breathing in and having that moment of mindfulness. It's eating nutritious food, right? Like, how do you nurse yourself? We always tell the patients eat good food, and yet we are not doing that. It's drinking enough water and getting enough sleep, right? Like, this is not it's not a rocket science. I wish I could come up with a magical thing to tell you, right? But it goes back to the basics. Do we sleep? Did we sleep? Did we drink water? Did we eat nutritious food? Did we have a moment of connection with their pet or people that we love? And did we have a moment of like stillness and mindfulness so we can reflect and we can check in with ourselves to know what we need?
Yeah. Well, and as you said that, it's the basics. But and unfortunately, Yelena, the basics are the things that we sometimes just ignore just because they are the basics.
Exactly.
Yeah.
But we have to come back there.
Yeah, those are the building blocks, and those are the things we need to pay attention to. Yeah. What would you say? What advice would you give to someone who wants to be a nurse? Because from my perspective, um, your journey to become a nurse, was not really a simple one from my perspective. As you talk about where you grew up and the circumstances that you saw and experienced and what propelled you there, it's almost as if you were propelled in that way. So, having come to nursing that way, what advice would you give to someone who wants to be a nurse?
Yeah. Nursing is not an easy profession to join, and find your why is my advice. When you know your why, you will go through the hurdles of the nursing school, and we all joke around it, right? That it's the hardest time of our lives. And you will be able to push through the difficulties, the incivilities that happen in nursing due to stress and burnout. You will be able to find that compassion, love, and integrity for your patients and in your role. So finding your why is my biggest advice, and being able to go back to that why. But recently, I working with my mentor, and recently she mentioned something about values, right? Like, lean in into your values when things get hard. You will always be able to fall back into your values. But how many of us have sit down and wrote down our values? Like, I actually had to sit down and like write down my values, right? And when you have the value of integrity or honesty, and something happens that may have somebody misunderstood you, somebody misinterpret your actions, right? You will be able to go back into your values. Well, what was my intention? Did I intended to do that, right? And then if your value is honesty, if your value is integrity, is kindness, then you can lean into those values. So not only I wrote down my why very long time ago, now I added the list of my values as well. And when things get hard, when things are difficult, I'm able to lean back into those things. So that's my biggest advice for nurses. If you do that, you will be truly the light in this profession.
Yeah. And that is really That is really very big. That's really very big because, as you said, once you articulate those things and you actually write them and can look at them, um, they become even more a part of you, and there's so much easier to access them because you
Yes.
have articulated them, whether internally or actually wrote them down. So awesome.
Yeah. That's your internal support system when you have your whys and values and goals and dreams, right? When they
Hmm.
are right there in front of you, it's much easier to lean in into them when they're
Yeah.
written down. I think
Yeah.
there's a special power into writing things down.
There is. There absolutely is. I can absolutely attest to that because, our days, as you say, things, as you mentioned earlier, things fluctuate. And
Mhm.
you can start out a day on a very high note. And then, suddenly it goes downhill really, really quickly. And
Yeah,
if you don't have those things around you, you can get lost down here somewhere. And it's so hard to climb
exactly.
back out. So it's yes, once you have, if you have articulated those things, it makes it much, much easier.
Yes, I agree with that 100%, Dale.
Yeah, yeah, yeah. So what would you say then that you see as, if you could tell me in one word, what would you say is the most essential quality of a nurse to you from your perspective?
It's 100% integrity.
Integrity, integrity.
Yes,
Yes.
yes.
Okay.
And I do believe that it encompasses everything but the nurse is, right? Like when we have that integrity, we will join our patient and meet them with compassion and empathy and love and kindness. We will take the steps that are, in our view, with our limited knowledge at that moment, at that time, right? To be kind to yourself, that you cannot predict the future, but you will act to their best interest if you have that high value of integrity.
Absolutely, absolutely, absolutely. So I have one more question, Yelena. So now you
Mm-hmm,
work in an area and in a facility that is very high value and very high tech.
mm-hmm,
I've had occasion in my life to have some contact with Stanford University Health System.
mm-hmm, mm-hmm,
Um, so given that. And given where you came from and the disparity there, how do you think that we can use technology
mm-hmm.
to try and bridge that kind of gap?
Yeah. So technology is a fascinating thing, right? Like it can truly connect people from very far away to
Hmm.
something that they truly need. My biggest vision is for hospitals like Stanford Healthcare being able to train and advise and consult physicians from overseas, right? Like help them to come to those conclusions and care and treatments
Hmm.
that the patients need through the lenses of the experiences and accesses to resources that we have here, and it's already happening. This is not something that is
Yeah,
not
it's
happening.
not
We do have,
futuristic.
exactly, yes, like we do have people from Stanford Healthcare traveling in countries with to provide the care for them, right? We do have programs where the resources are distributed to the not just other countries, but like coming back into our communities, right? Like we Stanford Health, for example, for our, which I was very proud to participate in, is our Black Nurses Association conference. Stanford Healthcare was one of the biggest sponsors of that conference, and they sent over 100 nurses to participate. They sponsored over 100 nurses from Stanford Healthcare to participate in that. And we were able to be there and provide the care for our communities at Stanford at San Francisco. we had like a health fair. And but kind of like going back to the technology, right? Like we had our town it was like a meeting where they were
Yeah,
sharing
town
all
hall
the
meeting.
yes, innovation that is happening. And right now, our physicians will have much more time, right? Because we have the OWL programs that will be transcribing their meetings
Yeah.
with their patients and putting that in the notes, right? So like those kind of things are just fascinating to me. That how can we use technology to free up the time of our care providers so they can engage in those things where the technology and in the future using technology to address the disparities in our communities and other countries as well.
Yeah, 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 yeah. And
Yeah.
I'm glad that you use that word innovation, because
Mm-hmm.
I see, as I speak to nurses from around the world, and I've been fortunate to work in several countries, what I know is that it's not equitable, you know. And so very often people have to become very innovative when you have fewer resources and whatever, and you have to make things work. And so from my perspective, I see that we can use technology to increase
Mm-hmm.
that kind of innovation in areas where you really don't have, just because you don't have um, the particular equipment or the particular instruments does not mean that you cannot become innovative and have, once that idea is opened,
Mm-hmm.
certainly you can, find one way to use the same kind of idea through technology in where you are.
Yes, and we
Yeah.
particularly with the Central Asian countries like Uzbekistan, Kazakhstan, where like me and my husbands are from. We
Hmm.
have a Silk Road Foundation right now, which is all the innovative technology that I created in those countries. People come and share that here.
Hmm.
Once
Yeah.
once a month there is a meeting, and we have people who are working. Who will adapt that in Stanford Healthcare, in UCSF, in other hospitals for the trials. And
Hmm.
this is a beautiful partnership that is between the institutions here in US and then abroad as well.
Yeah, yeah. It's awesome. I am so excited, honestly, about all
Mhm.
of these innovations and all this new technology I see on board. I sometimes I can't even begin to imagine what it would look like in another 5 years or so.
Exactly. It's already so innovative and so different that like
Yeah,
excited to see what future is to bring.
yeah, yep. It's very exciting. It's very exciting. Yelena, before
Mhm.
we go, any last words you'd like to leave us with?
Um, that is I think like kind of summarizing our conversation today,
Mhm.
it's very important for us as nurses to be part of the innovation, to be courageous enough to voice our concerns, to voice our challenges and struggles, so innovation can float into that and solve our problems. And then about self-care, care in science, and using care in science theory as the tool for self-care, well-being, uh, um, creating your why and leaning back into your values. Those are the things that I would love all the listeners to take away today.
Elena, I couldn't have said it any better myself. I thank you so very, very much for this conversation.
Thank you so
It's
much for your time.
enlightening and I truly enjoyed it. Thank you.
Yes, it was very nice to chat with you today as well.